Good afternoon. I want to thank everyone for joining us today for this exciting webinar. Today's webinar will be on the emergency situation of the COVID virus and the decisions being made on how to protect those at risk and vulnerable who happen to be in prisons and jails. And in this discussion, we're not only talking about the people who are confined, but the staff and that work and the folks that come in and out of the jail to provide services. So the Jewish Council for Public Affairs, JCPA, is a national hub of the local national community relations network that builds consensus on today's major issues. And we work very hard at providing fair and justice in America in a common way across our diverse country with all of our diverse communities. This initiative on criminal justice was initiated in 2016. It's basically designed to engage the Jewish community in criminal justice reform. And most recently at a national conference that we had back in February, we passed a comprehensive policy resolution on restorative justice. Through this work, we're very aware of the emergency situation taking place in our prisons and jails right now. We're also aware that we are not necessarily set up to handle such a public health crisis in these confinement facilities. And we believe there's a role to play for the Jewish community that cares about the dignity of people, equity, and fairness. So as Jews, we are all aware that our traditions are about how every human being should be valued, how we have inherent human dignity and worth, and how we should treat each other like we want to be treated ourselves. We want to make a difference in the world. And, you know, most of us are aware that the Torah mentions the obligation to love the stranger 36 times, which is greater than other obligations that are in the Torah. For our Jewish community to fully live out our lives, we can't hold ourselves at arm's length from the crises that exist around us. Our work on justice really flows from being in relationship with people who are vulnerable, from listening to people and their stories, and for standing up for their needs. And during this virus and pandemic, JCPA is not only amplifying and advocating for the needs of the Jewish community that is impacted by the virus, but also working with our partners on major concerns and impact that affects society. So this particular webinar, and there'll be a series of webinars related on criminal justice reform, is really designed as part of the subcommittee on JCPA's Criminal Justice Initiative that Bruce Turnbull and myself chair. My name is Faye Taxman. I'm a professor of criminology and health at George Mason University in Fairfax, Virginia. I've devoted my life's work to access and care for people who are justice involved. This webinar is devoted to the urgent need that presents us today in prisons and jails with the pandemic. Why? Why are we concerned? Well, we currently have over 2 million people in jail and prisons in any day, with untold numbers of staff who come in and out of these facilities. The spread of the virus in these settings can affect all of us and increase our own exposure. And for those that are released and fragile, we need to ensure that they're safe in the community with housing, food, and employment. So the urgency is here. Today, we've invited 2 experts to really help us understand the severity of the situation and the need to really act now. JCPA is going to be putting out an action statement that will be sent around with some specific actions that you can use in your own community. So our first presenter this afternoon is Rick Altice. Rick is a professor of medicine, epidemiology, and public health at Yale University. He's also a clinician, and he also works in local jails and around the world in prisons to improve the quality of care for people who are incarcerated. His primary expertise is on implementation and trying to improve the quality of care that occurs for people who are involved in the justice system. I could say a lot about Rick. I've known him a long time. He's a very prolific writer, prolific researcher, but most important, he is such a caring human being. I often say to him, I'd like you to be my doctor because he has such compassion for every person he meets. I also want to introduce our second panelist today, who's Nicole Porter. So Nicole works at one of my favorite organizations called the Sentencing Project. And for those of you who are interested in criminal justice reform, you really should go to the website of the Sentencing Project because they have been on the forefront for over 30 years of dealing with racial disparities and inequities in the justice system and reform of our sentencing and correctional policies. Nicole was named a new civil rights leader by Essence magazine for her work to eliminate mass incarceration. She too has passion for these issues, given her former work at the Texas ACLU's Prison and Jail Accountability Project, and her work has far-reaching impact. So we're first going to hear from Rick, who's going to give us kind of an overview of what we can learn, and then we'll turn our attention to hear from Nicole. So I'm going to turn it over to you, Dr. Altice.
Yeah. So first of all, it's really a pleasure to be here, and I want to echo everything that Faye said. I feel as though Faye is my sibling that was separated at birth, and we reunited later in our professional careers. And it's also an honor to be with Nicole, who is doing such important work to decarcerate our massive incarceration in the U.S. So to just set the stage. We're looking at two epidemics where there is really already convergence, but even a few weeks ago or even a few months ago, we knew that there was going to be this potential for convergence, and it will create, if unchecked and unheeded, the perfect storm for a disaster. So in the US, we're the highest rate of incarcerators in the world, 655 people per 100,000 US population, resulting in about 2.1 million people who are behind bars on any one day. That number sort of underestimates the sheer magnitude of the problem because there are over 10 million people who go in and out of this criminal justice setting, which is, much, much more complex than just prisons. We have jails, for which there's about 600,000 or 700,000 people. And those people on average spend, a couple of days. It's a bimodal distribution. There's another group who stay in for 30 days, but they're in and out. And we often think about our prisons and jails as being out of sight and out of mind. But indeed, these are individuals who are leaving our community for periods of time and then returning back to them. And so they are clearly, a fabric and a major important part of our community, and they're dynamic. And I'm going to get back to this issue of dynamics. Let me sort of also talk about the parallel epidemic that has been on everyone's mind of late. This is COVID-19. This is a SARS type 2 virus. We're in exponential mode right now in this country. Just this morning, I woke up to the news of over 228,000 people in this country who are known to be infected. That's the tip of the iceberg. We've had over 5,300 deaths, and this is an epidemic that is hitting us in waves, with a few epicenters that started early and others that are going to evolve. We really sort of have to think about what the implications are of what's happening with this, because on one hand, if it's just sort of an infection like the common cold, it's really good for people to get infected, and you have your common cold and you develop herd immunity, and when other people have immunity, it protects each other. That's not the case here. This is really a very, very different sort of scenario that most of you are probably aware of. But what's important and how we think about the criminal justice setting is, what are the factors that drive, an epidemic? And I'm going to put on my, clinical epidemiologist hat and, really sort of point out that there are three factors that you sort of need to think about. And the first one is the agent, COVID-19 itself. This is differently infectious than some other viruses in that people can be asymptomatic for a couple of days and they can transmit up to 48 hours before they have symptoms. So you can walk around and you can have a sort of a somewhat innocuous cough, or you can wipe your hands and you're transmitting to other people potentially. And it's very infectious. I mean, it really, you can get into contact. The good news is that it's not airborne like tuberculosis. It's person-to-person contact by droplet nuclei. So and that gets on surfaces and on door handles and all of these other sorts of things. So our hands to our mouth and our eyes and our mucous membranes are our routes of transmission. The other factor is the host. And while all of us are really at risk, everyone, this is a completely new virus. So we're all really at risk with it. But in terms of who's going to get really sick, that is, they're going to go into our hospitals, into our ICUs, it tends to affect the host somewhat differently. And there are factors that have evolved, including increasing age, 60 or greater. I hate to talk about that as older or elderly because I'm almost in that cohort, but also people who have underlying conditions. And so many of us have relatives or friends who are in this age group, or we have parents or grandparents. And so we're all interconnected in very, very important ways. And then the third element in order to sort of perpetuate an epidemic is the environment. And here we're going to be talking about specifically the environment of our prisons and jails. Now, if we want to sort of influence or impact, these drivers of the epidemic, the agent, that is the virus, the host or the individual or the environment, prisons, jails, our homes, etc., we do have some somewhat effective interventions. That is, you just don't hang out near people. You exercise what we're calling physical, not social distancing. I hope we're all being social somewhat here, especially in the Q&A, but physical distancing, 6 feet away from other people, really hand washing over and over and over and over again. I cannot sort of, say that, but the most important thing is to stay home. I have so many friends who tell me they want to do something good. They want to go pick up food for me. I say, stay home. I can fend for myself. I've been able to find food for 57 years. I can keep finding food. I'm good. And then, the other thing is the issue around herd immunity. And, if enough people get sick, of course, we'll develop herd immunity, but at a major cost because of the severity of the illness that brings people into our hospitals and into our ICUs. And we can see the devastation that not only happens from crowding, but you can imagine that the crowding means that you have less resources to provide to other patients. And so the quality of care, unfortunately, goes down and you have increased related death. And we have to do something about this, obviously, in order to basically buy some time so that we don't use all of our respirators in our hospital beds so that we can have an effective vaccine. But that's not coming, in the near couple of months. Now, what do we know about the virus in terms of how it impacts the healthcare system? And, unfortunately, about 18 or 1 out of 9 or 10 people, 1 out of 5 or 6 people, 18% of these people will end up in a hospital. And so that's a crowding phenomena right there. And these people have got to be isolated within the hospital setting, or at least cohorted with other people. And then of those, about a third or 6% of the people are going to find themselves into an intensive care unit. And at least until now, we don't really have what we know to be evidence-based treatments for the virus. We do know that what brings people into the intensive care unit is a great impact on an inflammatory response. And we have some medications that we're trying to use, but we are a long ways away from an evidence-based strategy to deal with people once they're infected. So we need to really deal with it beforehand. Now, this risk environment, I talked a little bit about the environment. The criminal justice setting is really important because the people who are brought into our criminal justice setting are people who are at high vulnerability. We know that we talk about the graying of the prison populations. Some people have called it the gray tsunami. Increasing numbers of people who are getting or in that age group who are at risk. I know that just a recent statistic for those who are over 65 years or older, their rate of incarceration is 95-fold higher than it is for younger people. So they're coming into our system. They're not the majority of people. It's a younger group still, but at a higher rate. It's increased by 63% over the last decade relative to sort of a flattening off or even a slight lowering for the overall incarceration. And people who are over the age of 60 who are coming into prisons, they're more likely to have non-communicable diseases that increase their risk of having an adverse consequence, such as lung disease, heart disease, kidney disease, and to the extent of non-communicable diseases that sort of maybe perhaps raise the risk of complications are individuals with HIV who are 3.5 times more likely to be incarcerated than the community, patients with hepatitis C, 10 times more likely. So we've got sort of a high group of high-risk people. So there is this concentrating effect that happens just based upon the way that we incarcerate people in this country. So we're here. The other sort of things about the environment that are absolutely crucial is that people live in close quarters, oftentimes for prolonged periods of time. You know, if you're coming into a healthcare appointment, you know, if you're lucky on a good day, you get a 15-minute appointment. People are spending a lot more than 15 minutes, and that's considered to be a sort of a high risk sort of contact if you come into this. And, you know, unlike people who are on, let's say, cruise ships who can actually sequester themselves in their own rooms, I wouldn't recommend anyone going on the cruise ship or any of those sorts of things under these circumstances. These individuals are often crowded in dormitories. They're using the same sinks, the same kitchen areas to eat, toilets, all of these things, and they're congregate. People don't have their own private cabin that they can sort of cohort and stay away. I mean, prisons and jails are somewhat different. There are isolated sort of units, but for the most part, a lot of people are in these sort of dormitory style housing, and they share a lot of things, and they're with, you know, people for a prolonged period of time. So if we think about the epidemic sort of coming into this country through skilled nursing facilities, short-term rehab facilities where we saw this initial outbreak, this is exactly what is going to happen as we are starting to hear about cases. And I think we're going to hear a little bit about, you know, some of the outbreaks later, housing, homeless shelters, all these places. It's also almost impossible for people within the criminal justice setting to separate and distance themselves just by virtue of the activities or inactivities that happen over time. And then what ends up happening because of this environment, there's this amplification of disease. And where we have the best data for this is tuberculosis. And that is much less infectious than, you know, than this COVID-19 virus. And that's not COVID-19, by the way. I was tested 2 days ago, and we've got lots of physical distancing. But there is this sort of high risk of transmission to others. The other thing about the prison environment is that, you know, there has been a prioritization for basically sanitizers, hand washing equipment, personal protective equipment that's been in hospitals first. And then the second tier is healthcare settings. But prisons and jails are not part of that discussion right now. And so they are incredibly poorly equipped to deal with even an initial outbreak or even a wide scale outbreak. They oftentimes have limited number of healthcare providers on limited shifts to provide them. And the people who are either working there have very little option but to go in and out. But the prisoners also have no control over whether they can self-isolate or do any of the things that people in communities would have the ability to do. And you can imagine that if you're in a situation where you're locking down people and trying to at least reduce the contact with other folks, when people do get sick, how do you get that information and how do you intervene in those individuals when you're distancing them? How do you monitor them in a way so that they're not actually developing advanced severe symptoms and either having to be transported to the hospital in extremis or not making it to the hospital themselves, finding their way to heaven? Now, the other thing that sort of drives this epidemic with these environments is movement. You need to have people moving in order to drive the epidemic. As I mentioned before, 10.5 million people go in and out over the course of a year, but that's really only just part of it. Most of that's through jails, it's true, but people do come out of prison. But we also have people who interact by sort of having appointments with their attorneys because they have court dates, or they go to court where they're often sitting in a group and on group buses in order to get there. But we also have an army of correctional officers and medical staff who go into the prison 7 days per week, 8-hour shifts, 24/7. That is a huge number of individuals who are going back to the community every single day, and they may be bringing in virus, but they also may be going out with the virus. And there's the potential for them who are taking care of people who have other comorbid conditions at home, grandma, grandpa, any of these other sorts of folks. So it is a completely porous. It's not like we have a cruise ship where we're not going to let them sort of dock at New York Harbor or in LA. We've got basically this movement that has to happen in order to keep things going around the clock. And then, of course, we do have people who are being discharged. And are we discharging them to places where they can stay safe? Or are they having to go to homeless shelters that, let's say, are in settings where they haven't closed them down or come up with alternatives to where folks are, heading out? Now, I'm a physician. I like to give out prescriptions. I don't like to give out too many of them, but I do like to prescribe things. And so if I were asked to sort of take out my prescription pad and say to you, this is what has to be done, and it doesn't have to be done tomorrow, it has to be done now. And I've been saying this for 3 or 4 or 5 or 6 weeks now. So there are places that are starting to make some changes. There are places that are being sued to do this. But the first thing that you have to do is you have to do something that I call a new word. It's decarcerate. So we have incarceration. I think we have to de-escalate the incarceration of people. And the way that we do that is we do that on both ends. We do that by really stopping the influx of people who go into our prisons and jails. We have to work with the police and tell the police not to arrest people for ridiculous, petty little things that happen all the time. They're in the wrong place at the wrong time, or that you have the probation or the parole officers who arrest a person who doesn't show up for their appointment. Is a phone call good enough? Potentially, we have to really rethink this. We have to think about judges who are sort of basically putting people in, and we have to work with bail to tell them to sort of remove these bail requirements, because people oftentimes don't have that 5 or 10% of the amount that's set for bail. It's $500 and they have to come up with, $50. Or $25. For some people, they just don't have that. And those people do not need to be going into our prison and jails. We also have to work on those people who are what I call the sitting ducks. And we have to increase our releases. And we have to do that in a meaningful, thoughtful way. We have to balance this public health emergency with public safety. In other words, we don't want to release somebody who's has a high risk for a violent crime to harm somebody when they get out. But most of our prisoners are not in for violent offenses. And so we really need to think about that. But we need to, first of all, identify all those people who are at increased vulnerability for an adverse consequence. That is, do they deserve a death sentence for spending 3 months or 3 days in there because they happen to be over the age of 60, or they've got one of these known comorbid conditions that's going to be, sort of a driver for them. And we really also need to take that further. We need to basically reduce the crowding by looking at younger people without violent offenses and getting them out. Surely reducing the numbers and the physical space and the contacts is going to be a major way to protect our staff in the prisons and the people who are in our prisons. We have a responsibility to all of that. We've done some modeling based upon the epidemic. It will be really tough to implement because it's hard work in prisons, but putting them on 12-hour shifts, so in other words, longer periods of time, but only working 5 days on and 5 days off, so that if you're going to develop symptoms, you'll know that before you come back in. But people who are working 5 days on and 2 days on, if they get exposed on that 4th day, the middle of their next week they're working, they're going to bring the virus back in. So we need to think about interesting ways to sort of have our people work. We need safe transfer to the community. Some of our patients are homeless, but many of them go back to families. And we need to know that they're going back to safe environments where they can do this. we need to, at least for the people who are going to remain, we need to have, adequate soap. We need to have alcohol disinfectants. We need to have personal protective equipment for our nursing staff who are in these very, very crowded settings. We need to remove all unnecessary in-person visits. It needs to move to teleconferencing, and we've got to set up the technology now. We've done it in every other part of our life. We can do it, and we should do it there. And one of the things, if we end up doing the right thing, and everyone who's on this teleconference is an important advocate for doing something. Each and every one of you can do and should do something, but it's an important way to study decarceration and what it will do for our universe, if you will, our country, whenever we have all of these people who probably shouldn't have been in prison in the first place. What will it do in order for us to have a more humane and kind and safe environment? Thank you so much.
Thank you, Rick, for giving us the lay of the land and helping us to understand the virus. I learned a couple things I didn't know, so that's really great. And we appreciate that. Rick will be back in a few minutes, but right now we're going to hear from Nicole Porter, who's going to talk about some of the advocacy efforts that you could think about using in your own community and the importance of those efforts. So I'm going to turn it over to Nicole for about the same amount of time, almost 20 minutes. All right. Thank you, Nicole.
Thank you, Faye, and thank you all for having me. It was wonderful to listen to Rick's earlier presentation. So I'm going to add to it, and I look forward to the Q&A later. So I do work at the Sentencing Project, where I'm the Director of Advocacy. The Sentencing Project is a research and advocacy organization based in DC. We do a range of research related to criminal justice practices and policies, and have been around for about 35 years. So I'm going to organize my comments in 3 ways. One, I'm going to talk about the policy and practice changes that have been implemented by correctional practitioners and law enforcement practitioners since the onset of the pandemic, particularly in the United States, when there were intentional efforts to address the spread, and how those intentional efforts played out in correctional settings at the federal, state, and local level. I'm also going to talk about advocacy responses to this pandemic. These advocacy responses coming from a range of constituencies and sectors within civil society in the United States, from the litigation community, the legal community, to civic organizations, including grassroots and faith-based organizations who are working at the federal level, but also within states and localities to create space and support, amplify support for releases and decarceration, with the goal of reducing the one constituency that is incredibly vulnerable to this disease if there are outbreaks in correctional facilities, and those include the men and women and youth who are incarcerated on any given day. And then I'm going to wrap up with action steps, where the advocacy is now, and what action items the participants on this call might follow up on in collaboration with the many other constituencies and coalitions that are doing work related to this issue as we continue our social distancing efforts and as the pandemic continues to unfold in the United States. So, the practice change that I'm going to highlight emphasizes structural barriers that previously were called for by various advocacy coalitions, but in the last few weeks, because of the urgency around the pandemic, have become politically possible and practically doable by a range of practitioners, including the president's attorney general, but also state and local officials, including governors, parole boards, at the state level, and at the local level, sheriff, district attorneys, and judges. So at the federal level, the recent stimulus package, known colloquially as CARES, authorized $850 million to states in support of federal responses within correctional systems, mostly prioritized to law enforcement for responses, including the purchasing of personal protection equipment for police officers and correctional staff and guards, also paying for overtime and hazard pay related, for law enforcement who are on the front lines and helping to keep communities safe. But it also includes money for health care. The language is fairly general within the recent CARES package. And so the money can also be designated for health care as a part of COVID-19 responses for correctional facilities at the state level, and also at the federal level in the Federal Bureau of Prisons. The money could also be prioritized towards keeping connections between incarcerated residents and their family members, perhaps funding telephone calls and communications, electronic communications, email communications, and other sorts of communication while facilities are more restrictive, given the effort to contain the spread. Several facilities at the state and at the federal level are on lockdown currently. And also to continue to maintain those connections so that loved ones are aware of the health and wellness of their incarcerated family member or loved one. One strategy that I'll return to later, and Rick touched on this in terms of, well, what happens to people who are released if various stakeholders do act on these calls for release? There are these resources, this $850 million could be prioritized and designated towards reentry and treatment support. There's a history of reentry networks, reentry service providers coalescing and connecting with governor offices to direct that funding into reentry support. And so that is one action item that state coalitions, including faith leaders, could be advocating for in the short term in direct response to COVID-19 and the implications for the justice-involved community, including reentry care. In addition to what's happening at the federal level, so you all may be aware that Attorney General Barr issued guidance that current federal prisoners who are eligible, these are generally elderly prisoners, prisoners qualified as medically vulnerable, can be transferred from the Federal Bureau of Prisons to home confinement. So they would still be in custody. They would just be in custody in their home and have to check in with a supervising corrections officer. And the practice may vary from district to district, but presumably that check-in would be over telephone call and perhaps some other measures would be in place. But Attorney General Barr issued that guidance. There isn't word yet on how many have been released to home confinement since the pandemic took hold, but that is a current possibility that eligible prisoners can seek court relief under in order to be returned to their home community. At the state level, I've documented policy and practice change in 30 states and locally in the District of Columbia for district residents who are convicted of local offenses. And I'll just briefly go over several state changes that have been documented in recent weeks. In California, there's a moratorium on new admissions to state prisons. There's a new guidance earlier this week expediting releases for 3,500 persons approved for parole. In addition to that, late last week, the governor commuted 21 persons, including persons sentenced to life imprisonment. In Colorado, the governor issued an executive order that prevents new persons from entering state prisons. In Florida, the Department of Corrections also limited new prison admissions to reduce the spread of COVID-19. In Georgia, officials are considering expediting clemency releases for persons sentenced to nonviolent offenses who are within 180 days of completing their prison term. In Hawaii, officials are exploring early releases to reduce the spread of COVID-19. In Iowa, there's efforts to accelerate releases for persons previously approved for parole. That number is about 700 persons who have been previously approved for parole. You all may have heard of the change in New Jersey last week, got a lot of national attention, where the state Supreme Court justice ruled that county should release eligible persons, including pretrial and persons sentenced to misdemeanors who are medically vulnerable or elderly from local county jails. And that estimated release number would be 1,000 individuals. In New York, Governor Cuomo issued an executive order authorizing the release of persons in jails on parole revocation. So these are people who are under parole supervision, but might have violated their parole, not because of a new offense, but because they were late to meetings with the parole officers. They may have had a dirty drug test. These are, non-criminal reasons for incarceration. And so the governor issued guidance to release about 1,000 people from incarceration because of that. And then also in Wisconsin, that Governor Evers also stopped new prison admissions since early March, given the COVID-19 pandemic. So there are some states where already we know that there's been substantial decarceration. The state of Connecticut, current incarceration population, which is combined with prison and jail detainees, is at its lowest rated population in 27 years. In Minnesota, since early March, the number of people in jail has declined by almost 40%. And these are due to changes in practice. And so we know that our incarceration rate on any given day is a function of politics, not just because the United States has more crime and because our residents tend to be, more criminal prone than in other parts of the country. I'll say that, this pandemic has animated a great deal of advocacy and opportunity for reform that's taken the shape of organized letters to various stakeholders who can immediately act upon their authority to release individuals, including governors, calling for the releases of elderly prisoners and medically vulnerable. The language should be specific, but has been specific, but also should create space for substantial reductions given what we know about the prison population. And this is where I'm going to depart a little bit from what Rick said earlier. The majority of people in state prisons around the country are in for violent offenses. And this is because of how extreme our sentencing practices are. And I can get into the nuances of that during the Q&A. But one factor around this is that we currently have more people sentenced to life imprisonment, serving time for life prison terms in the United States today. There's about 206,000 people in prison on life prison terms today than were in prison total in 1970. And so the policy around releases, given that we know a substantial number of people have aged in prison, given our long prison terms, should not be just about nonviolent offenses, but should be about releasing people who no longer pose a risk to public safety, because that would capture elderly prisoners who are medically vulnerable, who may have aged into disability and pose no immediate threat to public safety, but their crime of conviction could certainly have been a crime of violence. I'll say that the first week of the social distancing, there was a great deal of organized letters to these governors and to the president and to local officials. Now that we're a few weeks into social distancing and there's been some change that I've documented earlier, advocates and coalitions are looking to escalate advocacy efforts, are looking to figure out what comes next in targeting political influencers. And so those strategies involve leveraging tactics that can be employed while working from home. So a lot of this activism is happening online using platforms like Twitter, leveraging letters, but also strategic communications through op-eds from influential influencers who can be persuasive to governors and other local officials. You all might organize around this. Perhaps there are virtual meetings you can organize with political influencers in your community, within your states, to help influence the governors around some of the points that Rick and I have mentioned this afternoon. I'll also say that this conversation has been unifying. It's unified state communities that are focused on justice-involved, the justice-involved population, but it's also unified with other constituencies that haven't always been involved in criminal justice reform conversations. It's been very encouraging to hear Rick and his colleagues weigh in on decarceration practices, and their voices have been amplified in these recent discussions. In Maryland, there was a letter signed by 200 medical doctors at Johns Hopkins to Governor Hogan in support of releases from the state prison systems. And there have been similar letters organized by medical officials in other states as well. I think you all offer a great constituency that would be wonderful to amplify your support for releases in the response to COVID-19, including letters, but also figuring out what might come after a letter given the social distancing period we're in. And I'll just wrap up my comments by saying that this offers an opportunity to really lean in on decarceration and why it's so important given the medical crisis that the public health crisis that the country is going through, and that given these practical changes that are happening right now without any threat to public safety, that these pose questions for how decarceration practices can be employed even when the country isn't in the midst of public health crisis. So it's hard to think about that now, given the urgency of the situation, but part of my work will be to hold on to what's happening, the practice changes that have been documented, but also the voices and conversations that you all are having and how that's contributing to a collective conversation around decarceration and how the work that we're doing right now might contribute to ongoing conversations even long after this public health crisis has abated. So I'll wrap up now and I'll look forward to the Q&A.
Thank you very much, Nicole, for giving us an overview of how people can use their advocacy efforts. And I also want to put a plug in for your closing statement about, we are in a natural experiment right now to constrain and reduce the size of the criminal justice system. It's been, part of an agenda that we know needs to happen because of the harm that has occurred with our overuse of incarceration, but also mass supervision where people are placed on probation and parole and have the potential. So, this natural experiment hopefully will help us constrain the size of the system, and the goal will be to see how best to maintain that when life resumes. So I want to open it up right now. You can go into your, into your question and post questions. We have a couple questions that got posted when Nicole and Rick were giving us an overview of the lay of the land. So I'm gonna, the first question that was asked was, some people argue that we must make sure that released prisoners have a place to go and that maybe some people are safer in jail than home. How do we scale up release if we can't ensure that people are safer at home? So I don't know if it's Rick or Nicole who would like to answer that question.
I have a feeling that we both will probably chime in on this, but when people talk about the issue of safety, is it from sort of a maternal or a paternalistic perspective, or is it a public safety perspective, or is it an individual perspective? And, many people, who are coming in and out of prison, the ones that we talk about as being really vulnerable, let's say homeless people, it's very different. Some of those people have been chronically homeless for years, and they may be living under, I'm going to talk about the most severe, that society might say that you need to be safe, but these people have been managing themselves for a long time, and in some ways, and they're socially responsible. I mean, they're sort of living on very, very thin circumstances, but there are ways to, that people will take responsibility and do that. But I will also say that we do have a collective community responsibility, and this is a lot of work that we're doing, is to really get us to ramp up, basically college dorms, not like the big dormitories, but rooms, hotels, motels that nobody's traveling to use, and to make this a place for safety for individuals. We really have to think outside the box. And these places aren't making money right now anyway, and we should be making them available for people so that they've got, whether they're in the community or coming out of incarceration. We're having to do it now for people who are leaving hospitals. They can't go back to grandma until we know that. I mean, we've got to really think outside the box, and leaving a prison or jail should be like leaving a hospital.
Yes.
You need to
Let
have
me
space.
add, I think that offers an opportunity for advocacy, these questions about reentry and where prisoners and people in jail would go. So I mentioned that $850 million that was authorized in the Stimulus 3.0 package. So, callers who are interested in that can organize letters that provide guidance on reentry planning for people released under COVID-19. And there are some states that are actually looking at rapidly expanding transitional housing, including the sites that Rick just mentioned. So closed college dorms, underused hotels or motels. So those are practical solutions that should offer an opportunity and not a barrier to keeping people inside because of any questions raised around where they would go or how they would be supported if released for their safety, to potentially save their life.
All right, thank you. So there was another question that I'm going to ask Nicole because this is at the heart of her work here. So one question was, at sentencing, are judges considering to use alternatives now? And if so, what kind of alternatives? Because obviously, if we don't send people to prison or jail, then we don't have to look for options of how to get them out of prison and jail.
Yeah, great question. I think in many jurisdictions there are continuances on individual court cases, and what I failed to mention in my comments was that at this point all the tools are being used in the toolbox around decarceration and also to maintain people's constitutional rights towards fairness in the justice system and the legal system. And so what is happening is that many defense attorneys are doing case-by-case advocacy, getting continuances so that their clients' cases are delayed while the pandemic is playing out. But in the meantime, are seeking their pretrial release, and they've been successful in jurisdictions around the country. Also, there's been mass filings to release categories of people in jail or prison, including the parole revocations that I mentioned from New York, but in other jurisdictions as well. And so it's not necessarily a question for judges in terms of sentencing, but in terms of this window of time, how are the courts being used in support of decarceration? And judges have been very focused on helping to manage down jail population in Texas, in DC, in Georgia, because they also are concerned about people in jail or prison and are using their authority in support of that.
Thank you, Nicole. So the next question has to do with whether this conversation is relevant to the immigration detention population that we have. I think there's almost 40,000 people in those detention facilities across the U.S., not counting the Federal Bureau of Prisons. Rick, is your discussion about how the virus spreads relevant to those facilities too?
I think the whole discussion can't really one of the things that, first of all, let me just say that Nicole said that I thought was really important is the idea is that there are people there for violent offenses who are really no longer, a harm to society. And for the majority of people who are, here awaiting deportation, this stuff, they're not here for violent offenses either. And it's the whole issue of the environment, this crowding, that we have to be thinking about. And whatever it is that you do in order to, to decarcerate, if you will, is going to apply whether you're an illegal immigrant or not. It's really about getting people out of crowded, busy places where you're potentially going to sentence them to death.
Great, thank you.
And perpetuate the epidemic.
Yeah. So, Nicole, if you had to give an advocate in their local community one or two high-profile things they could do to weigh in on this issue, what would that be?
Well, I'd use the action statement that I know is coming out, after this call, and use that as a starting place to make calls to your congressional representative and your 2 U.S. senators, in addition to your governor, around why they should be looking at the incarcerated, the correctional facilities in their jurisdiction and working to decarcerate them using the guidance that is outlined in the action statement and that is supported by a range of constituencies, including public health professionals and other faith communities. And then I would also connect, continue to use this network to come together, to figure out what comes next after the initial communication and figure out ways to amplify calls for reform, given that, these are people's real lives who are languishing in prisons and jails. And if we don't do what we can in the immediate term, then, people will, the outcomes will be horrendous, and we just can't do nothing while this is happening.
Yeah. Okay, great. So Rick, there's an interest in trying to see how do we get wipes and sanitizers and other cleaning solutions to prisons and jails. Is that the most reasonable thing that we should be thinking about in terms of helping those who have to stay confined, is to provide these types of hygiene kits?
So, it's interesting. I sort of see this as a tiered sort of thing. There's always going to be a group of people who are going to be left behind. And while I think that the decarceration is probably the single most effective public health strategy to have an impact, there are going to be healthcare workers and prisoners who are not going to get out, who I also don't want to have to see, deal with this. And so I think we sort of need to think about that a lot of healthcare gets delivered in these settings, and sort of expanding, even though I can tell you at the hospital when I go, I'm desperate for personal protective equipment. I mean, my friends in the emergency room are putting on garbage bags. I mean, this is the sort of stuff that you're dealing with. And so when you've got a scarce resource, how do you allocate it? I mean, walking into an emergency room or an ICU is a really, really super high risk environment. So you have to prioritize. But sort of leaving the jails and prisons out of the entire discussion of options, I also don't think is appropriate. And for whatever it's worth, I mean, we should be making companies make this personal protective equipment 2 weeks ago so that we're not wearing, plastic garbage bags now. And people are not going to do it unless they're mandated. And we need to be pushing for that to happen.
But is this something that local nonprofits can really focus attention on, collecting from memberships? I know we're not all going out very much, but, as a way of really contributing,
it's tough for me because I'm really an advocate for healthcare workers in general, but I'm also an advocate for prisoners. And sort of how do you sort of make really hard decisions about that when you have almost nothing available? I would say that the advocacy that they can do is to really try to push communities that are not profoundly impacted. Like if you happen to be in a place where, you're in the middle of nowhere, but you've got hospitals and lots of PPE, to send it to places that do need it, as opposed to taking from the limited supply in a place like New York or Detroit that are just, suffering. It's going to take away from, those challenges. The things that people can do locally is they can take from low vulnerability places until we can ramp up things and send it to the high vulnerability places, which should include prisons and jails.
Okay, thank you. So we have, actually, I want to thank our audience because we have some really good questions and people sharing their experiences. So we have one group who talks about their volunteer work in New York State at a women's facility where they're aware that women are ill and the facility is not practicing isolation between those who are ill and not ill. They don't have sanitizing equipment. They don't have frequent hand washing because there's no soap. Masks and gloves are missing. Another person writes about the situation in the District of Columbia. For those of you who don't know, there is currently a lawsuit that the incarcerated people within the district have filed, and the DC Jail Correctional Officers Association has signed on to the statement because they feel that jail administrators are not managing the crisis. Even the DC Council, but prison bureaucracy is doing business as usual. And then, so, you know, we're hearing these stories. What would you advise people to do in those situations wherein the bureaucracy is doing status quo?
Well, I mean, if there's capacity amongst your members to submit amicus briefs to these pending lawsuits that are, that are pending in federal and state courts right now. So the lawsuit just mentioned from DC, it would be very powerful if there was a community affidavit, an affidavit from the communities of faith in the district in support of that. Other efforts to emphasize faith and public support. So if there's not capacity to submit an affidavit, perhaps a letter, an open letter that lawyers could use. My understanding from the lawyers who are on the front lines of this and helping to decarcerate day to day is that the public pressure that's coming in the form of letters, that's coming in the form of social media actions given our social distancing period, they're using that when they go before judges on an individual case basis in these mass filings, like the lawsuit just mentioned in DC and the lawsuit I mentioned in my earlier comments in New Jersey. They're using these public conversations that are happening as information to reinforce and amplify calls for what the courts should be doing to help decarcerate.
Thank you. And Rick, should pregnant women in prison be considered a high-risk population and included as those that should be released, such as elderly and medically fragile folks?
You know, it's interesting, the early data from China did not really show sort of an increased, risk of complications. In fact, pregnant women just weren't really part of that original sort of conversation. That's changed a bit as the epidemic has moved. What we're not seeing is, so first of all, that we don't know anything about whether there's, let's say, placental transfer or any sort of damage to a fetus at, first trimester or second trimester. We just don't know. And, at least from my perspective, to basically put a safe foot forward, I would certainly recommend, there is some immunosuppression that occurs as a consequence of pregnancy. And I have been recommending that we consider them as a somewhat protected. The data aren't there to support it yet. But based upon what we know about the biology of pregnancy, I would say that we need to think about that. I mean, and include them for now. I think we need to be proactive.
Mm-hmm. All right. So one last question before we close up for the afternoon, is Nicole. Hold on a second. So you mentioned that there are 30 states who have implemented some policy and practice changes. Obviously, they've done it in specific areas. So the question is, what about the other states? Why is it that they have not taken this on as an issue?
Well, I think that there's a chance that there are things happening that we don't know about. So what I presented on is what's publicly known, given media reports and what officials are, publicly sharing with general audiences around changes in practice related to the pandemic. But in other states, it may be because there's not public support or the public will to do so and to act on what's immediately possible. And so we need that. So in states where there are gaps, where we're not clearly aware of any changes, either at the local level or at the state level, if there are members of this call who are interested in organizing something there, a letter or some other activity, I'm happy to be a resource and to connect following this call in making that happen. And so I'll have to look at my list to align that with where the capacity is. but I'm certainly available to follow up on what might be possible going forward.
So I would encourage, if anyone has any questions, they can contact JPCA, and if they don't know how to contact Nicole, although the sentencing project is very easy to find, and you know, we will be happy to get answers from you and guidance from Nicole. So I want to thank Nicole and Rick today for their participation. We know everyone's got a lot going on right now, and this has really been informative in terms of thinking about sort of what does this virus really mean, how it affects us and the community, the Jewish community, but also how it affects those people who are in fragile situations, who are incarcerated. So JCPA will be sending out an action alert after this webinar so that you can reach out to your governors, your local government officials, your elected officials at all levels, other advocacy groups, to really build up support so that we reduce the risk of the virus spreading both within prisons, jails, and affecting us in the community. As we've heard today, this risk is very prevalent for the people who are incarcerated, but also for the people who work in those facilities, and the fact that they themselves could be exposing their families and loved ones. So we really encourage you to work with other diverse groups to mobilize action. You've heard a lot of good points. You'll get some more in our action alert. On Monday, April 6th at noon, we will have another webinar that will look at the immigration needs at detention facilities regarding the virus. And then on Tuesday at 1 p.m., April 7th, we'll be discussing another reform activity which has to do with probation and parole in the criminal justice system. I should mention that over 6 million people are on probation and parole, 1 in 30 people in our community. So this is a really important topic. So on behalf of JCPA, I want to thank everyone for their participation today. I want to thank Rick Altice and Nicole Porter for their great insights, and we hope everyone has a good afternoon. Thank you very much, and thanks for joining us.
Thank you.